Patient scan to tray creation. The first records we have to take, we got to get a pano and we got to get some models. I need an STL file so that I can input it into uLab so I can create these indirect bonding trays. And I really want the panorama. You're probably taking more photos, maybe a CBCT. I personally take intraoral scan to capture STLs, intraoral and extraoral photographs, a CBCT, and a pano before my consultation. So when a patient says, I'm ready to go, I have everything I need right there. But these are the two very basic things that you must have. Yeah, must. It's tough to use that word, but must have to effectively do a digital indirect bonding because you really want to know where those roots are to be able to effectively do this. You can see on the bottom part of the screen the ability to have presets. So I have Empower Metal and I have my normal presets of where I like to see certain brackets. The numbers that you see right here, I was setting these up for um, just for demonstration's sake. But you can have, when I went to Anoop Sandi's course about 12, 15 years ago, um, I really was really impressed with the fact that, and I know Pitts has some different things, and you can have your bracket positions based on where you want that to be. Do you want it much more gingival? Do you want it much more incisal for deep bites and much more gingival in the posterior? You have the freedom to preset all of those items. And if I want Empower Metal, I can have Empower Metal deep bite, Empower Metal open bite. So you can preset these things exactly where you want them. And then during the process that I'm going to show in a little bit, you're then able to change those positions as you see fit based on the case. So that's the setting. If anybody has used uLab, you've seen this process happen. This is just inputting. The thing I want to point out is when you bring the case in, you put the patient's name, you put the date of birth, um, straightforward. You know, it's good to put the right date of birth because then it's easy to refer back to later if you have patients with the same name. Here, when you add the patient information, you must select the IDB piece that you see right there. You must select that because if you don't, you won't have the option to do IDBs in the case itself. And then as you go through the case setup, you can see that very similar AI segments the teeth for you. You can do, if there's a little piece that's not quite segmented, you can fine tune it. This part is extremely important because sometimes if you have primary teeth, the numbers aren't exactly right. So please pause at that moment where you label the teeth and ensure, just a quick check, takes 2 seconds, but just a quick check to make sure that you've got those teeth numbered because the number on that tooth, lower left 3, lower right 5, lower left 6, whatever one it is which bracket is going to go on that tooth. So if they're off a little bit, which it happens rarely, but if they're off a little bit, now you've got a bracket on the wrong tooth and you have to go in and mess around with it. So much easier at this labeled teeth stage, this next stage after this, you can ensure that those teeth are labeled exactly like you want them to. Let's say you're missing premolars. Let's say you're missing a lower incisor. It might throw it off. It usually doesn't, but it might. So just a quick check, almost as fast as what you just saw right there, works out very, very well. These lines are important because the blue lines themselves, if you take them, if you take a moment or your technician takes a moment, lines those up on how the roots are lined up on the pano, that's going to make your bracket positions much less tweaks that you have to do when we get to the next stage where we're adding our brackets.